Welcome, everyone. I'm Megan Hansen with CGI, and I'd like to thank you for coming to our session this afternoon called Leading Change and Decision-Making in a Consensus-Driven Organization. And we did all joke that it is a mouthful of a title, but consensus-driven, see, there I go, I can barely get it out. Consensus-driven organizations are emerging, driven by civic involvement, a younger workforce who like to be collaborative, involved, and have their voice heard. And they offer valuable insight, but it is a very collaborative, relationship-based conversation, and making decisions in that environment can be challenging. And also, as leaders, leading that type of organization and groups or projects can also be challenging. And with these new emerging organizations and models, new techniques will be needed to manage and to lead change. So that's what we're hoping to accomplish in the title, so that's why it was so long, but hopefully we'll get it all in through our panel conversation. So our panel will discuss what the topic means to them, why we feel it is important, what are some of the challenges they've had addressing consensus-driven models, making decisions, and also leading folks, leading change in those type of environments, and then also give you some tips and techniques of things that you could take back and use in your organizations. So the format will be an overview by Karen Johnson on this topic, and then we'll move into a panel conversation and end with questions. So be thinking of some different questions. Hopefully it'll be interactive and it will be, a group conversation. But first of all, I'd like to introduce you to our panelists. First, in the middle is Chris Caietti. Chris has over 25 years of experience in state IT, with the last 16 years focusing on leading large transformational change initiatives at the California Lottery and at the California State Teachers Retirement System. Thank you, Chris.
Thanks, Megan. So I think one thing I've picked up, and a lot of you have probably picked up, is collaboration and decision-making is a key theme so far in this conference, right? It's very important as we move forward, and for a lot of the reasons that Megan talked about. It's really ensures support from all of the impacted stakeholders, not just internally with us between departments, but our citizenry is becoming more and more educated and aware and interested on what we're doing and how we're spending their money and how we're providing them service. They want the same kind of customer service they get from the private sector, from Amazon and from the Googles out there. They want the same demand from us. So we really need to collaborate and make sure that we're including them in our decision-making processes to meet their needs and provide the services that they're paying us to do. And that's not an easy thing to do, especially for us. We're historically not necessarily a consensus-driven organization within government. So it's really a leap for us to kind of move into that model, but it's also an imperative that we need to do. It also ensures that the best information is provided to the decision makers out there, because as Erika will mention, we all have a boss. Some of us have multiple bosses, and you're never going to have all of the information, but you want to make sure that they have enough information to make a really informed decision and reduce risk to what we're all doing out here.
Thank you. Next, from a student assistant at the Board of Equalization in 1991 to the Deputy Commissioner for Administration and Licensing Services at the California Department of Insurance today, Erika Sperbeck has spent the last 25 years honing her skills as a state government leader.
Thank you, Megan. Yes, you can do the math. I literally started working for the state when I was 18 years old, 25 years later. So what does leading change and decision-making in a consensus-driven organization mean to me? It means nothing ever gets done, right? If you've got to get everybody to agree on something, how do you do that? I mean, my family can't even agree what's for dinner, and we love each other. So when you bring a bunch of people into a workplace, they may not even like each other. They come from disparate backgrounds. How do you get them to agree on anything? Or it may mean that you have leaders who are making decisions which are then poorly executed or implemented because the people in the trenches either didn't understand or didn't agree with the decision in the first place, right? Those are possible outcomes. What we're here to talk today about is to give you some tips and techniques that hopefully you can take back and avoid those outcomes and actually achieve successful results. So I think it's important to start with a little definition and context to make sure that we have a shared understanding. Consensus is not unanimity, right? It's not unanimous. What it means is that everybody has an opportunity to inform the process or the decision, and that everybody can live with the result, right? So it's not necessarily that everybody agrees on the final result, but it's something that everybody can live with. Ideally, there are no perceived winners and losers, but in compromise, often you're going to have win-win and lose-lose, right? The definition of compromise, not everybody gets what they want. Everybody may give something up. Alternatives to consensus-driven organizations are autocratic approach, right? I'm the boss, so you do what I say. We've all dealt with that. We know how that works in implementing change and things like that. Also, there are majority rules approach. An example of that would be Robert's Rules of Order, which actually some organizations still use. I will tell you that that approach dates back to 1870. So either it's a classic or it's outdated. You be the judge. So for a number of reasons, we live in an increasingly complex world with increasingly complex problems. Teams are more important than ever in today's organizations. Those teams are often from disparate parts of the organization. They have disparate backgrounds, disparate experiences. Often they're geographically disparate as well, making communication, collaboration, and consensus building key to achieving and sustaining results. So over the years, I've come to pride myself as a problem solver, a change agent, and a consensus builder. I've even compiled literally a list of tips and techniques that I use in day-to-day decision making. I think you're going to hear common themes, both from Chris's opening remarks, from my opening remarks, and then in Karen's presentation. So I would encourage you, as Karen presents, make mental notes of those themes, and then at the end we'll come back and compare notes.
Great, thanks, Erika.
Thanks, Megan.
All right, our third panelist and our opening speaker is Karen Johnson. Karen is the Chief Deputy Director for the Department of Healthcare Services. She's responsible for managing and directing the day-to-day operations, as well as being responsible for implementing the department's policies and assisting in the formulation of policy to achieve the department's missions. Prior to her appointment with DHCS, Karen served for 2 years as the Deputy Director of Administration for the California State Board of Equalization. She also worked for the California Department of Food and Agriculture, where she held several positions, including the Director of Administration, Audit Director, and Auditor. And prior to Food and Ag, she was an auditor for the U.S. Department of Defense. So Karen will now share her perspective on leadership, change, and decision-making. Thanks, Karen. Thank you.
It's a pleasure to be here today to talk about consensus-driven organizations. And what I want to be able to do is really provide you some examples of things that we have done at the Department of Healthcare Services, give you some real-life examples, also talk, but before we go into some of those examples, I want to talk about maybe some global news stories that you've heard in the past. But first of all, when you think of things that have been successful, can you tell me or think about consensus-driven, what are some of those factors that actually worked? And I will tell you that a lot of times what I think are the outcomes of these decisions is really that the outcome is a better decision, because you have a group that has probably well over 100 years of experience. You come from multiple different backgrounds, and also some of the key leadership challenges that are facing us today is managing change, leading change, developing leaders, but also getting to the employee engagement aspect of it. So one of the things that we hear from employees is also, why do you want to stay with this organization besides training and development? But it's because they want to contribute to something bigger and greater. They want to have successes. They want to have wins. They want to be able to make a change, to improve and to be effective, make services better for the citizens that we're serving. So really the outcomes of this type of model is really to improve the business decisions, the outcomes, to create better teams, cohesive teams, better relationships, and then also we want to be able to have successful implementation. And you need the people, to be able to successfully implement that change. So I will tell you that sound decisions are something that is a skill that needs to be developed by you as a leader. Nothing will test your leadership than your ability to make decisions. Let me repeat that. Nothing will test your leadership but your ability to make decisions. And we'll go into some of those examples. So what are some of the challenges with consensus? It's oftentimes difficult, in terms of the speed. You want to move fast. So sometimes I hear, well, folks, when you have consensus, it's trying to get the group to come in, to decide, to all agree. And I think those are challenges that are easily overcome. And I always hold the leader, the team leader, or the leader overseeing an initiative, the executive sponsor, responsible for the effectiveness of the team. All right? Let's see. That didn't work. Okay, so today I want to be able to address a couple of objectives here. Number one is managing change, the importance of leading change, the expectations, as you heard from Chris and Erika, in terms of managing change. The expectations, we need to be transparent to who we're serving. They're expecting us to be better, faster, cheaper in terms of our performance. And we want to be able to make timely decisions. I'm going to highlight an example of when we had to make a decision with limited data. How many of you are sometimes involved with, the analysis paralysis, the data, being delayed, before decisions are made? So it's so important that, sometimes you exercise, you're kind of assessing the landscape, and you're able to make an effective decision because of some of the other consequences if you fail to make that timely decision. The other thing that we want to be able to cover today is, of course, effective decisions. So what is consensus and what is it not? Well, number one, as Erika mentioned, it's not complete agreement. Okay, we can't have, it would be great, but a lot of times we come from different backgrounds and different experiences that perhaps we don't have 100% agreement. It's not perfect, okay? And it's not the team leader or the executive sponsor that is imposing the decisions. Okay? It is the group collectively collaborating, coming together, and that voices are heard, that there's actively listening, we're listening to other individuals' points of views, that we're having a decision and outcome that's not watered down, or maybe not as effective, or it disregards critical examination or debate. All of those things are things that we're looking for. We're looking for debate, we're listening to other people's points of views. So we're really looking for superior decisions, all right? So I put this slide up there just to show that we're kind of constantly moving fast. I can tell you at Department of Healthcare Services, some of the facts, stats. We've gone from 7 million to 13.3 million beneficiaries that we're serving in California. That probably represents about 1 in every 3 or 4 Californians. Our budget went from, $40 billion from when I started with the organization to now close last year. I think it was $98 billion. This year, I think it's going to be close to $90 billion. So there's been a lot of changes with the implementation of the Affordable Care Act. So this is not just healthcare services, this is all of your departments, all of your agencies have challenges, and we're moving at lightning speed. So what are some of the challenges, as I mentioned? Creating an engaged workforce, managing change, developing potential leaders, creating a community around the mission, vision, and the goals of the organization. That is so important to have that vision and that mission. So when I'm leading teams, and I will tell you that most executives, most leaders spend 70% of their day in a team environment. When I look at my calendar, I have multiple people going to be participating in a discussion about trying to solve a complex issue. The other thing is that we need, in terms of critical leadership skills, is good communication. Communication is king. It's always been king. Will be remaining to be a king. Also, effective people management is very important. And then leading change. So I want to talk about, as I mentioned, some global issues, some news stories that you probably are familiar with, and then we'll talk a little bit about Department of Healthcare Services. But why do leaders fail? It is the outcomes of some of the decisions that are made. Perhaps some of the decisions were done in a vacuum. You know, perhaps we didn't get the right individuals with the right perspectives at the table. And so basically it then also is one bad decision compounded onto another bad decision. So going into some of these stories, how many of you recognize this Deepwater Horizon spill? This happened in 2010. Ultimately what failed was the equipment that failed. Yes. But what built up to that, it was the lack of decisions that were made by the engineering team. Some of those decisions were made in a vacuum. Some of those decisions did not take into consideration other points of views from other contractors. Other contractors had reported particular issues, particular strategies. Everybody knew that this particular well was a tough well. And they have documented, and they had well-experienced, engineers that have dealt with difficult wells. But the decisions that were made by the team, they didn't have all the people at the table, and also they sent the safety test engineer team member home 11 hours before the incident. And what happened was they bypassed running safety tests, which ultimately led to the failure, resulting in the loss of lives, plus over 200 million gallons of oil. And where was the leader? I didn't include those articles, but he was found in a yacht race off the coast of England. When they interviewed him, when they interviewed the chairman, some of the problems is that they were clueless. They didn't provide, they were trying to spin, BP was trying to spin, the situation, which wasn't what folks wanted to hear. And it was also known that he stated, "I just want my life back." How insensitive of a comment was that during that crisis? Here's another example. Everybody recognize this? Katrina. Probably that was multiple failures at government, both federal, state, and local level. The inability for us to really serve, the citizens. There was, what I want to say, lack of timely decision-making, lack of deployment. When the decisions were actually made to kind of deploy the troops, into the area, they couldn't get there, because they had downed trees and roads were blocked. And it was just one bad decision after another, lack of leadership. A lot of lessons to be learned out of here. But the other thing is that there was warnings from emergency preparedness and roundtable exercises that had talked about what could happen to those levees in the event that a hurricane this size would actually hit New Orleans. And it was unfortunate, but we were not prepared to handle that type of an event. All right, so those were kind of recent events. Anybody recognize this as happened in 1972? It's called the Osborne Reef. Osborne Reef. A group of fishermen got together and decided that they wanted to create an artificial habitat for fish off the coast of Fort Lauderdale. They dumped tires, old tires, into the ocean to create this reef. It was secured by the Army Corps of Engineers. It was approved by county government officials. But what folks didn't take into consideration is that the ropes that were keeping the tires together, the nylon rope and then the clips, and over time what happens in the salt water is eventually they kind of deteriorate and break apart, and then you had the tires, you know, with the waves and the tropical storms rolling onto the ocean floor and then nothing holding them in place. It was probably considered one of the most environmental disasters, along with some of the oil spills. But those tires exist today. They're out there in the ocean, and there's a massive cleanup and lots of dollars cost to the taxpayers to clean it up. Again, do you think they had all the right people at the table when they're making those kind of decisions? So that's why it's important, you know, when we talk about having a consensus organization, to really take into those other points of views. So, challenges. Most things are difficult before they're easy. I want to talk about healthcare services. 2011, we were facing a breach. And I received a phone call at 4:30 in the afternoon, and it was from our privacy officer. The first right move and the first right decision was that my scheduler cleared my calendar, allowed that person to come in and meet with me. We had one complaint, one incident, and one example where the outside of the envelope of our notice to the beneficiary had printed the Social Security number. Now, back at that time, we were probably serving about 7-8 million beneficiaries. So did it apply to all beneficiaries? Was it a subset of beneficiaries? We pulled the team together immediately, and it was a team comprised of IT, our program support branch, our administrative deputy director, our press person, our ledge person. We also brought in program folks. We also brought in our privacy officer. Everybody that could help address this problem. So the question is, do we start preparing notifications to the mailing that applied to 50,000 of our beneficiaries, or was it just a subset, or do we wait for more data to come in? What would you do in my shoes? The team collectively decided that this had to apply to everybody, and that we could not wait for more data to come in for us to launch our response. Within 24 hours, we had notification letters going out, both in English and Spanish. We had a call center that we're establishing, 1-800 number. We had talking points. We had a press release. We had, you know, all the teams. We had communications going out externally to other sister agencies, also to agency, California Health and Human Services, the governor's office, because communication was going to be important about how we manage this incident, because we wanted to make sure that they had all the information in case they got a phone call from somebody, they knew exactly where to direct it. We we worked all weekend. We had to notify the credit reporting agencies. We were putting contracts together to provide credit monitoring services. But what was our job? Our job was to protect our beneficiaries. We put them first. We took accountability. We took responsibility. And we didn't delay with the decision-making process. And it was a collective decision. We took a risk, a calculated risk, that was based upon everybody's experience, you know, with the file and how it was launched. On Monday, when I came into the office, how do you think I felt? I felt exhausted, but I was prepared and I was ready to face, you know, what may be coming our way. By 12 o'clock, we had many legislative staffers calling, we had press calling, and we were able to do what? Push a button. Here's our press release. Here's the notification to the ledge staffers, here's what happened, and then I spent the afternoon entertaining just interviews for TV, radio, newspaper, getting our message out. We're communicating with the advocates. We were doing everything we could to help protect these beneficiaries, because what was happening, our beneficiaries are a vulnerable population. Not only were we impacting them, but we're also impacting their families, because at the end of the day, they were the ones responsible for addressing the situation. Next issue, how am I doing on time? Good? Okay. I want to talk about a situation that happened in 2013. We were getting a lot of press inquiries about some of our healthcare providers. And it seemed to be a bit unusual about the number of requests that were coming in. And I said, something's not right here. We need to start drilling down on this particular situation. We just recently had transitioned the Department of Mental Health, Alcohol and Drug Program into our department. And so they were focused on one of our healthcare providers from those entities. So we looked at some of the data. I said, pull together the providers, the information, find out more data. Have we reviewed these providers? What's been their past history? What has been the past complaints? I said, and let's go out there and do some field reviews. We went out to 10 locations, and they were drug Medi-Cal providers. We went out to 10 locations that first week, and we found 100% fraudulent billings. So, being a former auditor, I knew that 10 out of 10 was not good. So I launched another 10 quickly into the field the following week. 10 out of 10 fraudulent billers. Now I'm up 2020, right? How many providers do we have? We have over 500 in the state of California. We have to move quickly. We assembled a team. But we also had to ask the questions is what did we miss and why were we missing it, and what points of failures in the past, because why wasn't this identified? We're looking at old historical data. A lot of times when auditors go out into the field, they're looking at data that is 2 years old, things that are already having supporting documentation, beneficiaries that aren't participating in the program anymore. I said, let's go on the ground and let's look at current activities, current observations. And let's not do it individually and in silos. Let's bring our medical professionals, let's bring our auditors, let's bring our investigators. And it's going to be a team of individuals that's going to conduct that review, and they're going to come to consensus in terms of what decisions or what outcomes is this a provider that should be serving our beneficiaries, or is this a provider that we need to take action immediately and temporarily suspend? After a year, we completed 500 facilities. We suspended over 200 and impacting our budget by about $60 million. We are in the process of now working with the California Department of Justice to prosecute those cases, but it was a true collaboration of bringing those folks together who have not worked together in the past, and oftentimes we're working in silos. How do you think that when the team showed up at the provider, they were looking at the provider more comprehensively than just their small piece? And because of that, I truly believe is how we were able to determine, which provider should continue to stay in this program. I could spend a lot of time talking about, those issues and the outcomes, and working with now, the California Department of Justice and the referrals, and, we are pursuing and doing everything we can to protect our dollars that we've been entrusted with. So I always say that we need to always, when we're trying to make decisions regarding complex problems, to always take a step back and kind of look at it holistically, comprehensively. Einstein put it, if he had 1 hour to solve a problem, how much of that time would he be thinking about how to solve it versus actually coming up with the decision? He said he'd spend 55 minutes of that 1 hour thinking about how to solve that problem and anticipating, kind of the consequences of each one of those decisions. So I have a document that I want to leave with you as a one-pager, because we always like to have, takeaways and things that you can leverage. And I put this together probably a couple of years ago, and I really leveraged in terms of when I think of things that have been successful, the teams that have come together to solve some complex problems. What were some of the successful ingredients, that were of the team members? Again, holding the leader accountable for the effectiveness of the team. Because I can tell you, it is a challenge getting everybody to sometimes work together or to get people stopped from operating in those silos. But it really is the responsibility of that team leader or the leader executive sponsor. And so some of the things that I found in terms of some of the things that have been successful within our organization is, number one, clear and common vision. You know, so when you're bringing the folks together, making sure everybody has the shared understanding and the common understanding of what we're trying to solve. Define the question. Define the question. Not necessarily answer, you know, kind of the question that is being posed, but first, are we defining it correctly? Defining the question. The next is commitment. The commitment of all the team members. Are they actively engaged? You know, and making sure that everybody's viewpoints are being heard and that everybody has a voice. And I always find that those people that are the critics help bring about a better decision or a better outcome. Making sure that we have clear communication, clear expectations of the team. Making sure that you have defined dates, making sure that they have, you know, obstacles and, you know, kind of clear the path so that the team is able to continue to succeed. Making sure that we have change agents or change champions that are also members of the team. And also don't forget the courage, you know, taking calculated risks and requires courage of the team. Allowing for that safe environment for the team to kind of bring forward great solutions. We've heard of risk-adverse organizations that kind of prohibits, I think, an organization from growing and moving forward. So I think it's really important that you have an environment where folks are able to think, you know, brainstorm and think of unique alternatives. Going back to the example in terms of taking the calculated risk, you know, launching forward with a notification to the beneficiaries within 24 hours. It can be done in state government. There is great things that can be accomplished. But it was the support and the collective decision of the team. You also need to have a culture of quality, of culture of change. You know, making sure that there is a message from the top in terms of the leadership, in terms of being able to do process improvement. Collaboration is everything, and so I always say that if you don't have all the partners at the table, start a campaign. Get those right members that are at the table, including those sister agencies or other departments that can help solve business problems. You want to establish cross-functional teams. You want to be able to have coaching available, and what I mean by coaching is that sometimes you have team members that perhaps aren't at the level that they need to be. So you need to bring them up to speed, and you need to help develop them, and perhaps team them up with somebody that is, you know, more experienced. And then, of course, I always say focus on the data. You know, what does the data say? Ask lots of questions of the data mining, but it's can't be, you got to kind of balance it with all the different equations that you have, you know, at play. Sometimes delayed decisions can be very costly, as in the case Katrina was. So thank you, and that's my presentation. I think I'm good on time, so I guess I'll turn it back over.
Thank you. Something that's important that you might have caught as Karen was talking, consensus is a process and an outcome. It's not just making a decision, it's the whole process, and it's clear that DHCS has the process and the culture to be able to support consensus in making those outcomes and decisions in the end. I wanted to give an opportunity for Erika to add anything else.
Thanks again, Megan. And thank you, Karen. A lot of great information. So I've spent today in hearing a number of different speakers do presentations. I see a lot of familiar faces, so I know a lot of you have done the same thing, heard different speakers. And I'm hearing the same themes and the same kind of ideas. And let me tell you, from my perspective, it's not rocket science. There are a million books on this stuff. There are a million people who do this, or millions of people who do this day in and day out in terms of leadership. But just because it's not rocket science and it's simple doesn't mean it's easy, right? Because as leaders, whether you're at the top of the organization or in the midst of the organization, this stuff is hard. So in addition to Karen's list that she's going to let you take away, I wanted to share a few of my guiding principles that I've come up with over the years that again I use literally in my day-to-day decision making. When a problem comes up, I sit back, I reflect, I think about my core values, my guiding principles, as well as the organizations that you happen to be working in, and use these to help shape decisions. So in terms of change, and I know we're going to do a Q&A, but if people have thoughts on these, please put a hand up and we could talk, because I'm only going to share a few. I'm going to share my whole list. But in terms of change is hard. You hear a lot of quotes about change. The only constant is change, right? One of the things that I've learned over the years is you don't change for the sake of changing, right? You do it to solve a problem. You do it to achieve an objective. And I think it's really important as you embark on a change to be really clear and explicit with yourself and with your team, with the organization, about what it is you're trying to achieve. What does success look like? What is the outcome that you desire? And keep your eye on that and revisit that periodically, because it's really easy to wander, at least for some of us. So it's really important to keep your eye on the prize. The other thing is, tone from the top is important. I think it's really important. But really, to sustain change, having grassroots, middle management, the folks in the trenches, come up with it, embrace it, buy in, lead it. So, we talk about leadership at all levels is really key to sustaining that change. We've all been in organizations where you get, the new leadership, the folks at the top of the org chart that sweep in and make changes, and then there's a bunch of people in the trenches that say, gosh, when these guys leave, we're going back to the way we used to do it, right? So getting that organizational buy-in is really key. Does anybody have anything they wanted to share on change? What's your one or two top guiding principle on change? Michael.
Change, specifically leading in the private sector for some time, now being in the public sector, what I've done is I've tried to align myself with best practices regarding the experiences I've had, and try to adopt them in a new environment. Sometimes it works, sometimes it doesn't.
Absolutely.
But it's the risk-driven behavior that has helped kind of move efforts forward.
Yeah, thank you for sharing that. Michael's in our Office of Strategic Planning, and and actually that brings up another theme, just kind of the old versus the new. The old guard versus the new guard, and the way we've always done things versus the way we want to do them going forward. Mm-hmm. In terms of decision making, let me give you kind of my top guiding principles, and you would think this would go without saying, but I'm telling you it does not. Use good judgment and common sense. Seriously, that will take you a long way. Always act with integrity. Do the right thing for the right reason. Make reasonable and defensible decisions, right? I use a couple tests, if you will. What does your decision look like on the front page of the Sacramento Bee? Or how do you speak to your decision? How do you defend your decision if the legislature invites you over to an oversight hearing? Those are really good tests to help you frame your decisions. This is a key one here, and Karen touched a lot on it. Relationships matter. Cultivate them. You might be surprised, you may not be surprised how much you can get done when you know, and it's even better when you like the people that you're making decisions and doing great stuff with. So spend the time cultivating those relationships. We use a term, and this is in the midst of consensus building, it's okay to disagree and commit. In other words, when you have all those right people at the table and you're behind closed doors and you're debating what decisions, pros and cons and options and alternatives. If everybody's on the same page and is in full agreement from minute one, you're missing something. Because what you want is people to say, wait, what about this? Did we think about that? When that door opens, this is along the lines of building consensus. Again, remember, it's not unanimity. It's making sure that everybody can live with the final decision. When that door opens, even if you disagreed, you're on board in supporting and implementing that decision, right? So disagree and commit is not to open the door and go out and say, well, we're implementing what Chris wanted. I didn't agree with it, so when it fails, it's not my fault, and I told you so. Healthy conflict is a good thing in an organization. And then I'll just, taking calculated risks, and I've heard a lot about intelligent risk taking, same thing. Always have a plan A and a plan B, and sometimes a plan C. And contingency planning, having a backup plan, I think is really worthwhile. And then in terms of communication, I'll just share a couple. I subscribe to communicate the right information to the right people at the right time. Information has to be timely to be useful. And if you have to err on a side, over-communicate, right? You want to over-communicate. You want to send those 50,000 notices versus the one and then go, we have 49,000 other people who got had the breach as well. So that's what I'd like to share, and thank you for that.
Yeah, definitely. Chris, would you like to add anything?
Yes, it's always hard to go last because they take everything else. So
We let you go first.
that's true. So that's a trade-off. So I agree with everything they said that they've already said, but a couple of things that I'd like to emphasize a little bit more is that we've already talked about is really having that common objective or vision when you're going to make a decision, especially some difficult decisions when you have a lot of decision makers in the room. It's very easy to kind of get sidetracked on having a discussion on what one of the points of view is, depending on the personality. They may take you down another road, and then everybody kind of follows down that road, and we've lost focus of why we're in here and what the purpose of the decision we're trying to make is. So really trying to facilitate as leaders, keeping everybody focused on what the objective is that you're trying to make the decision for, and not letting it kind of get sidetracked. And the other thing around, it's a culture of change, but really the key point to that is trust. You have to have an organization that the people, your stakeholders, whether it's the people that report to you or your customers or your external, staff out there, they have to trust that you're making an important decision, but that you're also trusting that the information they're giving you is because they are the most knowledgeable, they're doing it for the right reasons, they're trying to solve the problem as well. So it has to be a mutual environment of trust, which goes back to the safety of, it needs to be a safe environment for people to speak their minds and have that contrary opinion and not feel like they're going to get ganged up on, even if it's not politically correct sometimes, to actually say what's on the table. That's how we're going to try to address the problem. Get it on the table and address it. Acknowledge and respond to the feedback, even to the naysayers out there. What a lot of people, it's not that they're not heard, but they'll speak up, and if it's not acknowledged that what they've provided and what they've contributed to the decision-making process isn't even acknowledged, that's kind of hits buy-in sometimes. So always do a full circle. Acknowledge those people that contributed, even if what they provided wasn't actually part of the final decision. You can acknowledge and say, thank you for what you've provided. We heard you. This had impact on our decision-making process. They just want to know that they were heard and it was evaluated, and that it really increases your likelihood of buy-in as you go forward. And setting up expectations up front of what consensus is, kind of going back to the definition of consensus. Letting everybody know consensus doesn't mean that we all have to agree or we're all going to have a nice, casual conversation in here. The expectation is we're trying to come to a solution to a tough decision that we have to make, and that everybody is on the same page for that objective.
Great, thanks. All right, this does leave us a little bit of time for questions. Does anyone have a question? All right. Oh, good.
So one of you just mentioned transparency, and I realize that, risk taking there are different types of risks, and depending on exactly what's going on, some transparency has to be shielded due to privacy issues. But outside of that, how do you see the role of transparency in achieving consensus?
I know, Chris, I'm going to take all your talking points. No, transparency is a great concept. It's a great buzzword. From my perspective, the point I made about over-communicate rather than under-communicate, and communicating the right information to the right people at the right time, it is all about transparency. Certainly internally, but also externally with your stakeholders. And I think Chris and Karen have both touched on this. As public agencies, we are accountable. We're accountable to somebody in the private sector, or taxpayers or fee payers, and in our case, the insurance industry and licensees and such. So I think, sometimes balancing that, those conversations are certainly had within my department. Actually, I work for, as most of us do, I probably work for a different elected official than you do. I work for Insurance Commissioner Dave Jones. But we have a lot of those robust discussions about how much to share and when to share and, who to share with. So it definitely, I will say, Karen used the term communication is king, I think. I actually use communication as queen. I don't know if it's the same, but no, communication certainly is key. Yes, absolutely.
And the only thing I'd add is, it kind of goes back to my discussion about trust, right? So we are trusted to provide services to the public out there, and we are held accountable to a higher level of transparency than the private sector. So it is critical, and going back to keeping everybody focused, you make sure that people are focused on solving the problem, and if that includes using transparency to solve that problem, we really need to lead that. A lot of times people get caught up on whether or not they should be transparent, and then they lose focus of participating and trying to solve the problem. So really, it is really critical to make sure that transparency is safe in that environment.
Right. And I just want to add what we did with the breach letter. We did share out with a few of our advocates, a few of our shareholders before we actually finalized the letter, because we wanted to make sure that we had those partners on board with us, because they could also assist us with solving the problem. So the timing of when to be transparent is critical, but I think ultimately you do need to have those trusted partners as well, besides your own folks in-house. And I think there was another question.
Yeah, Richard?
Okay.
So in the case of the breach, after the incident, was there an opportunity to go back to your IT department or the program area to figure out, what change should we be making in terms of how we do this?
Yes. Yes, so the question was, after the breach and after the incident happened, were there other changes, going back to the IT department? We actually, at the same time, launched an internal review by our internal audit office, to conduct the controls, to find out where were the gaps and how we could improve that so it would prevent it from happening again. And so that was all documented, and then we made changes into our process because there were certainly gaps, and there was at least 3 opportunities that we could have caught it.
Can I add to that, Megan? I just was going to say, the after-action debrief, or what we used to call them good, bad, and ugly, right? Learning opportunities. When something goes wrong, there's an opportunity there, one, to react and respond appropriately, but then also, what do we do differently to prevent that going forward? But also to document kind of, it sounds bureaucratic, but write it down. What do we do when this stuff happens? So that there's, a tool for folks that come after you.
And more importantly, don't just write it down, actually implement those. We have a lot of it, where we have these cases where people sit down and do a lessons learned or a post review of what happened, they'll document that, and then it just goes on the shelf because we carry on. The fire's over, we can focus back on the day-to-day, but really, you need to take that final extra step in making sure that you implement those things that you've learned, because it'll be worse the next time it happens. You say, well, we did document it, and here it is. We didn't do anything with it.
Right.
So,
Yeah, this probably goes without saying as well, but if you're making the same mistakes over and over, there's a different problem there. So hopefully you're making different mistakes.
Learning. All right, we actually only have a couple more minutes, and I wanted to give each of you an opportunity. If everyone here was to take one thing away, I wanted you to spend just a minute to explain what you feel it should be. And let Chris go first so everyone else doesn't steal his answers.
Wow, like I haven't covered it already. Really, it's, for me, it goes back to go back and set up that culture of trust in your organizations. If you do that, a lot of this will happen naturally. If you lead that, as a leader of that trust, it'll happen naturally, and a lot of this will just flow by itself. You won't have to go out and educate. You won't have to go talk to everybody. They will just naturally be drawn to that, and it'll become part of your culture. Once it becomes part of your culture, it's very simple. It goes back to it should be simple, right?
So I just wanted to add, in addition to those comments, is I always say it's for exceptional results, it's all about the people. So if you have the people, you have the right team members at the table, everything else will fall into place. But it's very important that there is active engagement and commitment, that you can't just set up a team and then walk away. I look at my day and I am juggling a lot of different balls in the air, and I'm thinking, I got to go grab this one, I got to hold on to it, okay, and I got to provide it enough direction, enough guidance, and then I can't hold on to it for very long. I need to release it, so the timing of the release also allows for engagement and empowerment of the teams. So again, I always say hire hard, right? Hire the right people, get the right people on, create the teams. Consensus-driven organization is a way to lead, and it brings about, I think, superior decisions.
So really, Karen stole mine, but that's okay. No, I would say the same thing. People. It's about people. We do what we do through our teams, through our people. But I'm going to tie in what Chris said as well. But it starts with you. It starts with us, with me, right? What can I do as a leader? And again, not just if you're on the top of an org chart. It doesn't matter where you are in the org chart. What can you do as a leader? Be really clear about who you are and what you stand for. Karen's going to give you a takeaway in her one-pager. I shared some from my one-pager. It's okay to borrow. I know I did from mentors and coaches that I've had, and I'm sure Chris and Karen have probably borrowed some bullets as well, but create your own list so that you have it, you can pull it out, in particularly in tough situations, just to keep grounded and remind you of who you are as a leader and what you stand for.
Great, thank you. All right, well, we are out the end of our time. I want to thank all of you for joining us for this conversation, and I also would like to take this opportunity to thank the panel. They put in a lot of preparation and this participation, so thank you so much. I will be at this door handing these out, and hopefully someone else will be at that door. Thank you very much.